I have, oh, got it. I, that threw me. Sorry about that. So I, I, I was really thinking to myself today, what are some of the really critical places to go to think about, to reflect on around around this journey towards wellness that so many of us are on ourselves, and that we deeply want to contribute towards. It's interesting. In the last presentation, I talked about the Indigenous determinants of health, or actually the relational determinants of health, and the new framework that has been, very much years in the creation of, and the conception of, and for us, for me, I think especially is landing more and more all of the time. And it's really interesting. I think for me, one of my appreciations about taking the time to really delve into the framework and delve into the relational determinants of health is that I've come to understand in a deeper way that wellness, although we reflect on it, although we think about it, we don't work in it. And so it is still something that is too often outside of the doing, outside of the ways of being. And so it's interesting. I think for me, I realized that, and it was one of the things that I talked about in the last talk, and in going through the relational determinants of health, is that so much of the space that we occupy is really focused on harm, and is really focused on helping and supporting communities and people to move away from the harm that is controlling their lives, that is controlling the community, that is that really is smothering, so many aspects of what can be wellness. And so often our place of engagement is in those aspects of harm. And so when we start to talk about how is it that we want to include wellness within our ways of working with community, I think it's a bigger journey than what we actually realize it to be. It sounds so simple in sentence. It sounds so simple. And yet the work of it really is going to need to create a shift. There's going to need to be a shift in order to do it. In preparing for today, I really wanted to, I think one of the things that people will have noticed in these three talks is that in the first talk, I also used a paper from the National Collaborating Center for Indigenous Health, and it really went through us better understanding determinants of health. And then I shifted it over into the relational determinants of health, and how is it that we better understand harm? How is it that we better understand the deficits that we often work with? And then how do we understand the journey that we can contribute towards? And what is even the landing place of the journey? And in today's talk, I thought I really wanted to do a little bit more focusing on how it is that we even vision the future, because sometimes it's envisioning the future, and it's in hearing our First Nations, our Inuit, our Métis brothers and sisters in hearing how they envision the future, that really is going to allow us to better contribute towards what communities and nations are saying, this is what we want. This is what we need. This is the gap so that we can do this better. And it's interesting. I had a harder time with this, I think, than maybe what I expected to have, because so often we often are thinking and reflecting on those wellness goals, on the places of wellness, but really to start delving into visioning for future is big. It actually, I think for me, I thought to myself, it's really big to start thinking that through. And so I think then when something feels really big and we don't necessarily know the pathway, then let's start looking to some of those that we do look towards for guidance, some of the knowledge holders that we look towards because of the knowledge that they hold, and say, what can we do? And what are the ways that we can help out, so that we can start visioning in different ways towards a better future. And so for me, what I really loved about this particular report, one, is that it was headed by Dr. Margot Greenwood, who for me is one of my heroes. I am really in awe of Margot's ability to translate knowledge in ways that are meaningful for us to pick up and are doable for us to pick up, and and usually go into various themes so that there is something there that we are able to pick up, and Margot is incredible for really also modeling collaboration. When she, or when the National Collaborating Center for Indigenous Health is tasked with contributing to either national action plans or is tasked with creating, a national action plan to work towards something, often within, of course, the population health or public health field. She always brings in so many people, to work on those visions. And so I want to just acknowledge all of those that really have participated. So Wendy, if you can go a couple slides down, because I do have the land acknowledgement here, and I know that we had we spoke about that in the introduction. For me, one of the things that I'm really appreciative of is the team that worked together in really bringing the relational determinants of health to life, and that really looked at the challenges and the reality of the challenges that we do work with, together with aspects of wellness that communities are saying to us, here is what we need, and in any journey that we are on together, there has to be a contribution somewhere within the circle of wellness. There has to be a contribution to that, because in the absence of that, there isn't necessarily a direction forward. In the absence of that, what happens is that we come to a place of hitting a stop sign. And, if we're just working towards removing barriers, if we're just working towards alleviating harm from somebody's life, we'll hit a stop sign, but we're not necessarily then continuing the journey or supporting their journey or supporting a community's journey in the way forward. And that's a big transition for us. That's a really, really big transition for us. And it's a space where I know that for me, I need a lot of guidance around this one. And I think for me, what really was highlighted within this particular paper is that as we started to look at visioning the future, it created a limited amount of suggestions on ways that we can support. If you start to look thematically at what First Nations, Inuit, and Métis are asking us for, it gave us a limited amount of suggestions. And I appreciate a limited amount of suggestions because often we get to hear all of the suggestions. And the challenge with all of the suggestions is that it becomes too overwhelming. And once you get overwhelmed, we tend to have less ability to move. There's less ability to move when we're overwhelmed. But when we have a few suggestions, then there is greater ability in that. And I appreciated that about visioning the future, is that I could decipher it down to a few different themes. And so really, I thought today what I wanted to go through is I want to go through the primary theme or a couple of themes from each, one from the Assembly of First Nations, one from the National Métis Council, and one from the Inuit Tamarri Kapsari, and look at what they have highlighted to be areas that would be the most helpful for those that are actually wanting to support their communities or support the Indigenous peoples of those nations. So I thought, let's bring it down a little bit. And in that, it hopefully creates a greater ability to say, what actions can we take? What can we do then towards just towards the support, of that journey to wellness. You go to the next slide, Wendy. One of the things here, I just I just captured this from Margot's words in the beginning, is that when we start talking about Indigenous knowledge, it's so interesting in that information from community, we have to be able to hear in different ways, because so often it can be either encoded in the stories. Sometimes we'll ask a question, and in that question, I heard Lionel, Lionel, you referred to that this morning. You said, I heard this question and it made me think of this prophecy. And it's so interesting. That is often our way of sharing. Somebody will say, I have this question. And in response, we'll hear, I have a story, and it's because often what we want to do is we want to generate somebody's knowledge to be able to solve their questions or answer their questions for themselves. I think sometimes we forget the wisdom that we have, and we tend to often ask outside. But when stories are shared in a way to help us remember our own knowledge, it can ground that knowledge as we remember it, or that we bring some of our knowledge into a different area. Sometimes it's about connecting the right brain and the left brain and saying, what about this could answer this over here? And it changes the lens. And in that change of lens, it changes the answer, even though it was us that actually answered the question. I love this quote: knowledge is encoded in stories and is generated through retelling as an experiential distilling of wisdom, as a transfer from wisdom keepers to new generations. Today we work in circles, we work in cycles, we work in figures, even though there is heavy Indigenous knowledge within those, um, the knowledge of the community resource, Indigenous knowledge, is generated through experience and dialogue, reflection, and collaboration. I love the way Dr. Greenwood puts these words together and says, you can recognize all of these things, and in fact, don't just recognize all of these things. What works better for you? Does it work better for you to do some type of a model or to do a picture that shows you a way of thinking? It was really interesting. I remember when I years ago, when me and Deb and Wendy were really starting to look at some of the questions that we had within many of the Indigenous communities I was working on violence prevention in. I was, I've worked in countless communities and together with countless communities around aspects of violence prevention, aspects of community planning that can help to alleviate community harm, so much of, I've worked in those areas for years. And in an experience years ago, one of the things that I remember in a conversation, me and Deb, one of the things she said, what is your conceptual model? And it was so interesting. My first thought was, you're speaking Greek to me. That was my first thought. You are speaking Greek to me. I have no idea what you are even asking me to do. And she said, no, I asked all of my students this. And it's like, no. and it was just, I remember just having this, we had this funny dialogue. And it wasn't until, we started to put a diagram together, which was the first diagram. It was the diagram before the relational determinants of health. That particular diagram changed many times, but it was us putting these circles and cycles and webs together that for me helped me to get grounded and clear on what it is that I wanted to do. That clarity that had for me really was paramount, because often what I had is I always felt really challenged, and just Wendy, you can bring it to the next slide. I often felt really challenged when communities would approach me and they would say, you've been doing violence prevention work for countless years. Tell us the pathway. Tell us the pathway. And it was always such a difficult thing to do, because up until that time, my intended pathway was to get people to canoe away from the cycle of violence. That was the pathway. It was really to work with community and work with individuals to move away from harm. That was my pathway. And what I realized was the gaps in my pathway. And I realized there was massive gaps in my pathway, and there needed to be real intentional pathways towards healing, pathways towards wellness, pathways that talked about reconnecting to all my relations, pathways that included self-determination, traditional ways of knowing, being, and doing, pathways that helped us to better understand cultural relationships, roles and responsibilities, family connectivity, support during difficult times. How do we connect to land? What does stewardship mean in our lives? Like, we needed to get to a place of integrating those pathways so that wellness could start to take root in places where it seemed to be such a gap, where it just seemed to be such a gap. And it was so interesting, because in many ways, although I received direction to say, let's start putting this into picture, then those pictures needed to be informed by elders that I work with, by the communities that I work with. Like, it was really interesting, and that needed to then start to be better informed so that we could say, how do we get intentional? And that was for me a really huge question. When I started to really think about how do we envision the future, a large thing that we have to ask ourselves is, how do I become intentional? How do I get intentional in the things that I'm doing so that the contribution is even happening in the right way? So, so it was so interesting for me. I think that one of the things I really realized as I was reading through this particular report is, what stood out so much was the direction from the three national Indigenous bodies. That really stood out very strongly to me. And what also stood out is, I thought, I'm starting to be able to read it with a new lens. And I'm starting to do that because I've done my drawings. And that has been so helpful. It's been so helpful. And that I really encourage in people. I really encourage to do the drawings that really help you to show yourself, where is it that I'm placed? How is it that I'm placed? What is the direction? And what are those goals that I have in the circle of wellness, that if I want to hone into things, I can do that in a way that's going to contribute. So let's walk through a little bit around what the different organizations started to look at as we started to look at their visions. And they started to not just necessarily state what their visions are, but they focus very much on the current place that we are and some of the gaps that they're starting to identify that will help them to then get further in their vision. And gaps is as important as envisioning the future. It's like, where are our pain points? Where are the things that we need to sit with, or that we need to focus on? If we focused on something specific, then that can in and of itself take us really far. And sometimes the other points will even come with it. It's one of those things we don't always know. So when the Assembly of First Nations, when they were tasked with the questions around looking at envisioning wellness for their community, their first statement looked at, we envision a transformative system that is grounded in culture and led by First Nations to inspire, protect, and support individual and collective wellness. And I wasn't surprised at their vision, because the Assembly of First Nations, there are 698 First Nations that are members of the Assembly of First Nations. And within their membership, one of the biggest areas of development right now, one of the biggest areas of change within the AFN, is that they're starting to really unpack systems and what is challenging within systems. And so they have been deeply involved with looking at the health system and saying, how do we address racism within the health system? How do we build better cultural safety within the health system? They have been really engaged with the justice system and saying, how do we address racism within the justice system? They've been really involved with the education system. How do we promote more Indigenous education? And so for the Assembly of First Nations, their goals were very much based in that place where they are situated and the different areas where they are offering, I would say, really national leadership around systems change. And so much of what they're doing right now is offering that national leadership around systems change. They have a really strong voice because there's so many First Nations. They have such a critical voice, and they're using it to say, how do we help to promote the change of systems, but how do we also help to promote rights-based systems? It's interesting, one of the newest changes within Assembly of First Nations is that they have a new department that focuses specifically on human rights frameworks. And how is it that we better understand human rights frameworks? Where do those need to be better integrated through the systems? Because if they were better integrated through the systems, we'd have less systems challenges. So for them, their overarching goals were, how do we get the relationships right? Because they're looking very much at I think at that reality that when we look at Indigenous partners, they're too often not equal. They're too often not equal partners, either in the federal, provincial, or territorial areas. They're often not equal partners. And so getting the relationships right is critical. That Indigenous has to be at the table. And Assembly of First Nations is a great voice to say Indigenous has to be at the table. The other area that they have really focused on is looking at First Nations capacity. And it's interesting because as we start to look at how do we support community-based, it's another area where it's so easy for organizations to be urban in nature. Our internet is better. There's office space. There's more people. And so we can see the various things that contribute so much to that. But what happens is that in the absence of being in community, we also have then an absence of the way of walk of community. And often when we start to look at organizations in urban areas, there's a quickness, there is a pressure, there's a pressure to produce, there's a pressure to meet objectives, so all of a sudden things become based in the deliverables as opposed to residing in the relationship. And residing in the relationship in community it's often a given that is the way communities walk. And so I think too often we do jump to ease, and that's a challenge. The other area that they really focused on is they said, when we start to look at transformative systems that are grounded in culture, we have to also look at what is needed to sustain different ways of doing things, because in order to move in more balance, there needs to not be a weight on the Western aspects of deliverables. There needs to not be a weight there. And so often when we start to look at investments or at sustainable investments, there has to be culture that also leads that. There has to be aspects of culture that contribute towards that. So it was really interesting to see the Assembly of First Nations, and to see as they are visioning the future, those are the three areas that they're saying, work with us in these three particular areas. Because if we can start to look at having much greater capacity, having funding that recognizes culture, and feeling equal at the table, that in and of itself is going to create a better ground space and a better starting place for working on wellness together. So I thought that's good information. That's really good information. The Métis National Council worked really differently around this. It was very different in that, and I think for me, one of the things that we often, often we say First Nations, Métis, Inuit, but again, in language, these things are easy. In language that flows. There's a flow to that. But yet the reality is that when we start to look at recognized bodies in Canada, the Assembly of First Nations and First Nations is recognized in Canada. The Inuit Tamari Kapasari, the 4 Inuit regions are recognized in Canada. There is still a space for the Métis and the Métis peoples where there is an invisibility for them. And that becomes a huge challenge in working towards wellness. It's difficult to work towards wellness when the feeling is that you're invisible. If that's the starting place, then so much of the focus then actually needs to be on what's the gap in terms of either legislation or recognition that is creating an invisibility. It was interesting in that one of the things that the Métis National Council really spoke about is that even when we look at census data, there are spaces for, like there's different census information that often goes into First Nations communities, that often goes into Inuit hamlets. And many Métis people are not on their traditional territories. Territory looks different for the Métis Nation. And so when we look at that in and of itself is a discrepancy, and so they started to unpack the discrepancies. And one thing that they've really realized is that there's a data discrepancy for them. And what they would like is they want support to ensure that Métis are included in the data, that there is either systems, for many First Nations community, even when it comes to research work that we do together, and we start to look at principles that govern research work, those are really pretty well grounded, in Inuit hamlets, where the Inuit have Inuit guidelines for research, with Inuit peoples. For First Nations communities, we have the OCAP principles. And so even though the Métis National Council and many Métis communities might use aspects of OCAP, there's a lot of aspects that don't necessarily fit there. So it's interesting in that what the Métis are finding very strongly is that there's a lack of data having to do with Métis. Often what's reported in different understandings of harm, which is often that starting place before we work towards wellness, is we have to first understand the picture. And they're feeling that there's a gap in even understanding it. And they said what they need the most help with is they need the most help with data and data systems, data protection instruments, and data understanding, ways to do analysis and such. That was what was really, really big for the Métis. When we start to look at the Inuit and the Inuit Kapasari, when they started to look at their vision, for me, this I wasn't surprised so much at this. It's really interesting, when we look across this wonderful country, the Inuit have had the least amount of time with contact. And that's a significant thing. When there has been 5 to 15 generations within a family of living cross-culturally, what happens is that the cross-cultural, it really flows into each other to create a different space. And that happens more with each generation. With the Inuit, there is many Inuit elders that we work with where they themselves were a part of contact with non-Indigenous peoples. So it's very new to the Inuit. Contact is new to the Inuit. And what that means is it means that culture is still what is lived in community. It's what is lived. It's what guides. It's how things flow. And so we have so much we can learn from the Inuit because of their cultural strength, because of how grounded they are in their cultural strength. So when they talked about their vision, the Inuit Community Kapasari's vision for the future, Inuit are healthy, thriving, and prospering through unity and self-determination. To achieve this vision, long-standing equity gaps and social determinants of health between Inuit and other Canadians must be closed. Moving forward, Inuit self-determination in public health programs, services, and policies promoting health and preventing injury, illness, and premature death will be essential for confronting the systemic discrimination and racism that created and perpetuate unacceptable health equity gaps for Inuit. What a strong statement. What an absolutely strong statement. The Inuit were so clear in saying, if we're looking at our vision for the future, our vision for the future, it needs to reside in self-determination. It needs to reside in that. And it was really, for me, what I really enjoyed reading the case study on breastfeeding, because that brought their vision to life. It brought the vision to life in a really significant way. It's so interesting in that, and if you look at the next slide, Wendy, one of the things that's critical to understand with the Inuit is that they are closer to their value system, their traditional value system, in a lived way than most other Indigenous peoples in the world. They are closer to this in a lived way. And because it is a part of their life, it is something that they ask of either people that come into their community or programs or support that come into their community, that those things need to come in through their value system. And so it's interesting. One of the things for me, what was really highlighted in that case study on breastfeeding and young breastfeeding moms is how they work through aspects or work through their values to instill their teachings. And everything that happens, whether or not that is going hunting, whether that's eating country food, how we teach our children, what we do and how we live as a family, everything goes through their value system and is always brought back to that, because everything has to be brought back to the child. The Inuit live in a child-centered community like no other people live in a child-centered community, and so they talked about some of their values and said, in this particular, just by the mom feeding and, her mom, and her granny and her aunties, helping her to learn this, it's like, this is not just respecting all living things. This is also about promoting, promoting common good. This is also about how we start that process of maintaining harmony and balance, by showing this baby that everybody is a participant. Everybody is a participant in its life and its wellness and its want for wellness. So it's so interesting. That this particular diagram is a diagram that we did when working with some of the Inuit hamlets, and it was a way to help us to better understand how it is that we need to understand the Inuit principles so that we can work in our program in a better way. And I so appreciated that. I appreciated the guidance from community that said, you have to work in this way. You have to integrate this in order, in order to be here. They organized their principles in a very particular way that said, we have 4 big laws. They call them the big laws. And, and the 4 big laws: working for the common good, respecting all living things, maintaining harmony and balance, and continually planning and preparing for the future. It's so interesting that everything that flows in has to flow through those 4 big laws. And then from there, then they start to look at the other values. When they talked about these 6 values that they relate different teachings to within that case study, these 6 values that are around the circle, the 6 different values they talked about, but know that those 6 values flow through every one of the big laws. They flow through every one of the big laws. And so I really, for me, I always come back to how much the Inuit have to teach us, because if we could work in this way, if we could work in the way that says, what are our big laws? What are our big laws? And because the big laws are what a big law means is that this isn't negotiable. Working for the common good, it's not negotiable. Respecting all living things is not negotiable. It's so interesting. Like, there's other values that are sometimes highlighted in different ways of teaching or being, but regardless of what they are, they go through the big laws, and I think to myself, what are our big laws? I think that it's something that we need to think about. What are our big laws? Because that's critical. And when we have our big laws is what's going to participate to keep us in balance. It's going to actually help to ensure we stay in balance. And in staying in balance, we are visioning the future. That is what staying in balance is, to envision the future. It is to contribute to the future, and it's to focus and think more through the future. The other things that I also really appreciated is that one of the big areas that was touched on by all 3 of the national bodies, but Dr. Greenwood really wanted to just have a special section that basically was just really crystal clear, is that we have to start addressing racism within systems. We have to address that if we are going to vision the future, and we so would like to vision a future without racism so ever present. Then we have to start looking at what needs to be unpacked in the systems. Where can we participate? How can we speak out? How do we need to advocate for change? What can actually more effective and meaningful advocacy look like? What can that look like? I think that we have huge voice that, I know in Canada, the goal of working towards addressing racism is massive. And yet the turn away or the challenges seem to also be massive, and so it's something that we have to start getting better at. We have to start saying we need to unpack some different things, because it keeps coming up, and the stories are devastating. The stories are multiple and horrific and far, far too present, and so it's something that we have to remember to really not stop. Another area that really was clear in a way, and I'm showing it in a different way here, but when they started to talk about the history of disease and how is it that we understand the history of disease, it's so interesting. It talked about tuberculosis, so, in one of the chapters, like where it talked about diabetes, it talked about tuberculosis. it talked about sexually transmitted diseases. It talked about this flow and this history that that basically colonization has created in Indigenous communities. Contact has created this set of disease and sickness within communities that has really, really permeated communities. And we have to better understand that. I wanted to put this up to highlight it because, it's so interesting when we start to look at the history of harm. There is so much knowledge and focus on residential schools. There is this growing focus on the 60 scoop. There is starting to be more and more focus on, on the police, on criminal justice, on substance abuse, and even a focus, with our understanding of climate change. There's also a growing focus of resource extraction, resource abuse, but there's still not a huge focus, or there maybe isn't, there hasn't been this huge focus for us to better understand the history of disease within communities and how that has allowed and supported these other abuses to actually happen through time. And there hasn't been huge understanding of that. And I thought this paper highlighted that really, really well. It took us on this timeline through this history of disease. And it's important to know that. It's important to understand each one of these layers. If we want to unpack the layer, we need to understand the layer. And so to me, I appreciated that it gave us that, because it said moving forward, and especially moving forward from a time of COVID and still being in COVID and still having different degrees of lockdown or isolation with particular communities, depending on whether COVID has hit them. With that, it's important that we best integrate that. And I'm not going to go deep into many more. In fact, and this next one here, I had, I was thinking to myself, because they've kind of gone back to how is it that we understand determinants of health, how, then we have to go kind of into, this helps us to unpack it. And of course, in conjunction with the history of harm, it really helps. But I'll leave that as one of the ones that people can just look at that, within their own package that they received from Stacy. But if we look at the next slide, then really, I think one of the huge themes to me that I could really see through the conversations in building capacity and the considerations for capacity, in understanding data and actually doing inquiry together and in different ways, and of ensuring that we're values-based. For me, I think what really stood out is that, lots of what I've worked on around our considerations for engagement have been around how is it that we work in a way that supports self-determination, and that, we work together with community to say, here's content information. How would you like to do this? How do we work in culturally safe ways, but also from a place of being trauma informed and understanding that working towards visioning the future always needs to be trauma informed. How do we put culture first? How do we do that? I think that's one of the areas where we are still so far behind. And I know that for me, I really, although there was lots of messaging in here around how we put culture first, I think the most significant one for me was listening to and reading the Inuit case study, because to me that demonstrated putting culture first, putting Indigenous values into the lens so that you are working through it is a way you can put culture first. It's a way that you can do that. And how do we support community cohesion so that we can work together? Because as the Assembly of First Nations aptly pointed out, it's like we have to start being on a more equal footing. And again, and we're not there yet. We're not in that place of equal footing. We have to be seen as equal in the conversations, as equal in the work, as equal in the places that we want to go to. And we can't envision the future if we're consistently behind. We can't, because then it's still just about unpacking still, as opposed to being also in the forefront of the visioning. And so that's, so for me, it was really interesting in that if I could look to what their strong themes were for recommendations and how we need to think through it, I need then to look at how do those fit within our considerations so that we're doing the right work with the right considerations and the right voice that we're hearing. So for me, that was how I thought through it. That was, like I said, I felt that for me, it was a thinking exercise. It was a pushback for me around how can we do this differently? How can we do this better? I'm always at the one to learn. I'm always at the one to say, how do I work differently? And for me, I appreciated the voices and how they frame things to say, here's how to work with us in a better way. So those for me are the things that really stood out. And I didn't.
Oh, sorry, go ahead, Jill.
Well, I was going to say, I didn't. I mean, there's a couple other slides. I don't, like I said, that that people can actually just take a look at in the package that they have, because it just it shows you some of the enabling protection frameworks. They didn't talk so much about that, but they definitely referenced the different protection frameworks, even though they didn't go into great detail. I think often within organizations, within academia, within community-based organizations or programs, we need to figure out how do we enable these protection frameworks. This stands for the United Nations Declaration on the Rights of Indigenous Peoples, the Truth and Reconciliation Commission, their calls to action, the Murdered Missing Indigenous Women's Inquiry, and their calls to justice. Like, that's kind of what that represents there. And for me, that just kind of shows the diagram of how do we break this down so that I can ensure that that's within the work that we're doing here. And then, yeah, the slide after this is just is the last slide where, it just kind of goes back to, the determinants of health and the National Center, the National Collaborating Center on Indigenous Health. To me, they have brought together, it's interesting in that so often we talk about intersectionality. We talk about how do these different pieces, how do the sectors come together to envision together, and they've been really at the forefront of helping us to learn that. And for me, I think that that's, and it's been through their determinants of health that they've done that. They've brought in not just a health lens, they've brought in a wellness lens. And by bringing in a wellness lens, it's been able to help us to envision what is the education that's needed? What is the public safety that is needed? What is the public health that is needed? What are the programs that are needed? To me, they've really, really been a leader in showing us what intersectionality means and how can we envision and do this differently and better.